Merci beaucoup. Hello, everyone. What a pleasure to be back in Halifax today. It was a great opportunity to sit down and talk with students about their future and about our collective future. Obviously, a focus on healthcare, but a lot of the questions around affordability, a lot of questions around the tough moments that young people, indeed all Canadians, are facing right now, with inflation on its way down, but still high. With interest rates having an impact, with the geopolitical challenges, whether it's the impacts of the war in Ukraine or supply chain disruptions that continues. People are facing tough times, and that's why as a government we've stepped up in our supports for students, but we're also making sure we're delivering targeted supports to people as they need it. One of the things that people are talking about a lot, not just this morning, but across the country, is the need for better results in our healthcare systems. That's why a few weeks ago we sat down to offer the provinces close to $200 billion worth of investments if they were ready to move forward in 4 targeted areas that will improve the outcomes and results for Canadians of the new investments in healthcare. Specifically, better access to family doctors, making sure that we're monitoring how many more Canadians every year have access to family care doctors and primary care teams. Moving forward on better supports for frontline health workers, making sure we're moving faster on credential recognition and licensing, making sure we're reducing the backlogs of surgeries, making sure that we're supporting people who are increasingly getting burned out after some long years of pandemic and continued strains on our healthcare systems. Moving forward on better mental health supports for young people, for all Canadians. We know that mental health challenges continue to be a significant challenge for Canadians who are facing challenges since the pandemic and before, whether it's increases in anxiety, increase in various mental health challenges. We need a system that's going to be able to respond in a timely way and give them those supports. And finally, we need modern healthcare systems that are grounded in better data collection, better information sharing that's going to allow us to have the best possible care for Canadians right across the country and ensure that Canadians are receiving the best possible care across the country by being able to understand and quantify exactly what's going on across the country. These are the things that we're focused on, and quite frankly, the news today that all 4 Atlantic provinces plus Ontario have signed on memorandums of understandings to start the negotiations right now on how we're going to deliver these better outcomes for Canadians are great news. When we made the healthcare announcement and we had the meeting with the First Ministers a few weeks ago, I said we were going to get moving forward on negotiations within weeks, not months, and that's exactly what we're doing. I can also highlight that there's many other jurisdictions, provinces across the country that are interested in starting the important work of delivering better results for Canadians. But I do want to take a moment to thank the premiers of Nova Scotia, New Brunswick, Prince Edward Island, Newfoundland and Labrador, and Ontario for being leaders in stepping up and starting to really improve healthcare systems for their citizens at a time of crisis. C'était un grand plaisir ce matin d'être ici à Halifax pour échanger avec des étudiants, pour parler des défis auxquels ils font face, pour parler du système de santé. Aujourd'hui, on annonce qu'il y a 5 différentes provinces, les 4 provinces de l'Atlantique et l'Ontario, qui ont accepté de négocier avec le gouvernement fédéral pour livrer le meilleur service en soins de santé à leurs citoyens pour les années à venir, basé sur notre approche qu'on a annoncée il y a quelques semaines de presque 200 milliards de dollars en nouvel investissement, en investissement dans nos systèmes de santé sur les prochains 10 ans. Donc, on va s'asseoir avec ces provinces pour commencer à parler de comment on va augmenter le nombre de médecins de famille qui seront là pour les Canadiens dans leur région et à travers le pays. Comment on va mieux appuyer les travailleurs de la santé pour s'assurer qu'on a de la relève qui s'en vient, que les gens qui sont là sont appuyés de la bonne façon et pour réduire les listes d'attente, évidemment. On va aussi investir pour assurer que des meilleurs soins en santé mentale sont accessibles de façon rapide selon les besoins des citoyens. Et on va aussi s'assurer, bien sûr, que tous ces investissements sont ancrés dans de meilleures informations de la santé, de meilleures données pour s'assurer que les gens ont les bons soins de la bonne façon et qu'on puisse voir à travers le pays que tout le monde est en train d'accéder à des meilleurs résultats dans les systèmes de santé. C'est du travail que nous sommes très contents de pouvoir entamer avec les provinces. On avait promis qu'on allait s'avancer pour les négociations dans des semaines, pas dans des mois. C'est exactement ce qu'on est en train de voir aujourd'hui et je peux vous assurer qu'on s'attend à plusieurs autres annonces avec d'autres provinces qui vont le faire dans les jours et la semaine à venir. Alors, je suis très content d'être ici à Halifax, très content de prendre vos questions aujourd'hui.
Prime Minister, merci Premier ministre. We have 20 minutes for questions from media. Nous avons 20 minutes pour les questions des médias. And we will start with CBC. À vous la parole.
Thank you. Hi, Prime Minister. It's Gareth Hampshire from CBC Nova Scotia. You alluded to it a couple of times in the town hall and again just now that it's tough times for a lot of families. Nova Scotia has been wanting to implement a school lunch program, but has been waiting for federal money, especially since this was a commitment that has been made. Currently, the lunches are provided on an ad hoc basis, depending on the schools. Are you ready to commit to that today, and when will that happen?
We will continue our conversations with the government of Nova Scotia. We know right across the country, making sure that kids can study on full bellies, have access to breakfast programs, to lunch programs, is a real priority for lots of families and for lots of communities. We're pleased that Nova Scotia is looking to move forward on that, and I look forward to continuing those discussions.
So you can't say today when it will happen?
I'm looking forward to continuing those discussions, and I'm not here to make an announcement on that today.
Thank you. Next question.
Hey, Prime Minister. Kristen Ashkate, CTV National News. Since the beginning of the war, Canada has committed $1 billion in military assistance to Ukraine. Are you willing to sustain that level of support for the next 5 years should the war last that long?
Canada will continue to do whatever is necessary to ensure that Russia does not benefit from having illegally invaded Ukraine. We will stand with the people of Ukraine as long as it takes. People of Ukraine are not just fighting for protection of their own territory, of their language, of their identity, of their sovereignty. They are fighting to uphold the rules that underpin all of our democracies. Territorial integrity, respect for sovereignty, respect for international law and the UN Charter. These are things that have led to a period of stability and prosperity around the world over the past 75 years that have been unprecedented. Russia chose to destabilize that and to put all that into question. And it's not just a question of Russia's behavior towards Ukraine or any countries around Russia. It's a question of other countries around the world wondering that, oh, perhaps might makes right now. Perhaps because we have a larger army than our neighbor, we can invade. We can attack. The consequences of Canadians not standing with Ukraine, of the world not standing with Ukraine right now, could be devastating and long-reaching for the entire planet. That's why Canada and our allies will continue to stand with the people of Ukraine as long as it takes.
Follow-up.
Thank you. In the past week, media have obtained leaked documents from CSIS about attempts by China to influence the outcome of federal elections here in Canada. Your own spy agency is leaking documents to the press. Are you concerned about this, and why do you think this is happening?
We are, of course, always concerned about national security. We are always concerned about ensuring that people can have confidence that our intelligence agencies in particular are able to do their job and keep their secrets and function as responsible agencies. We have at the same time moved forward with unprecedented measures of oversight over those agencies. You know, despite the Conservatives' objections for many, many years, in 2015, we brought in a National Security and Intelligence Committee of parliamentarians from all different parties, from the House and the Senate, who are given top secret clearance and allowed to lean in on everything our intelligence and security agencies are doing to keep Canadians safe. This was an important measure around oversight that Conservatives always resisted, but that we know is all about ensuring that our agencies are doing the right things to keep Canadians safe and aligning with our values and priorities as a country. So we will continue to ensure that we have proper oversight over our agencies. We are very concerned with the leaks, particularly because there are so many inaccuracies in those leaks. But that's an entire other question.
Thank you. Next question.
Heidi Petrachik with CTV Atlantic. Hello, Prime Minister. Wondering about the healthcare transfers, particularly to the Atlantic provinces. It sounds like provinces will have to meet some metrics to keep the money. How are you going to keep provinces accountable when it comes to how they spend healthcare dollars?
This is something we're actually approaching based on the success of our childcare deals. We knew that different provinces across the country had very different approaches to delivering childcare in their country, in their regions, and therefore how the federal government would make sure that we were investing to support citizens and families across the country in a fair and reasonable way involved negotiating directly with different jurisdictions according to their requirements. Now, we set out clear metrics. We needed to see half price reduction in childcare fees in the first year, getting to $10 a day childcare within 5 years. How they worked on that, how many spaces they added to, how they were going to ensure that we're properly paying early childhood educators, those were all things that we negotiated bilaterally, and they are going to be held to the number of spaces they committed to obtaining or creating in that time. That is what we approached on childcare. We have a similar approach on healthcare, understanding that different provinces have different levels of access, for example, to primary care physicians already, different abilities to deliver mental health care, different data systems or different levels of sophistication in their data. So what we are going to do the work right now with provinces on is sitting down with them and saying, okay, what is your target for access to primary care physicians? Do you want to get to 95% of your residents with primary care physicians? Are you going to be satisfied with 90 or even just 75? Depending on where you are right now, what are you going to set as your priority, and how much of this money that we're putting forward are you going to invest in that? They get to generate that target. If they choose to get 75%, they will have to explain to their citizens why they're accepting that a quarter of their citizens won't have access to primary care. But we're looking for ambitious targets that are reasonable for them, that they can hit, that they can be accountable to, that will improve access to primary care in a significant way. Similarly across the board, with the exception of data. For data, we need to make sure that people are developing sophisticated data systems that allow them to empower their health community to have the proper information on all the patients they're treating and be comparable and give us a national picture of how health is doing in Canada with clear outcomes and numbers. Those are things that we're going to be rolling up our sleeves to deliver, but the targets and the metrics will be negotiated together province by province. That's why we're embarking on 13 different negotiations now, not just one, but that's the way to make sure that at the end of the day, all Canadians get access to the best quality health care.
I do have a follow-up question, but I
En
have
français?
a colleague. En français.
Nous savions que les besoins et les systèmes de santé à travers le pays varient. Il y a des provinces qui font une meilleure job déjà dans l'accès à des médecins de famille, par exemple, que d'autres. Alors, on savait que nous allions devoir travailler avec chaque province pour ajuster le tir, pour être la bonne solution pour les résidents de cette province-là. Donc, avec les provinces, nous allons fixer des cibles qu'eux, ils vont viser de vouloir, je sais pas, 80%, 90% d'accès à des médecins de famille, peut-être 99% accès à des médecins de famille dans quelques endroits, pour ensuite dire comment ils vont y arriver, et ça va être public. Les gens vont pouvoir voir dans les années à venir s'ils sont en train de répondre à ces exigences que nous allions négocier ensemble. Pareil pour les investissements en soins de santé mentale, pareil pour l'appui pour les travailleurs dans notre système de santé. Par rapport à l'information et les données, nous voulons évidemment que les citoyens et les médecins puissent avoir le meilleur accès à des informations de qualité, mais nous voulons aussi, évidemment, qu'on puisse comparer et comprendre ce qui se passe à l'échelle pan-canadienne dans nos systèmes de santé. Donc, ça va être important que nos systèmes de données puissent communiquer, puissent se comprendre. Mais ça fait partie des négociations que nous allons avoir et c'est pour ça que nous nous embarquons sur 13 différentes négociations dans les systèmes de santé pour offrir de meilleurs résultats appropriés à tous les Canadiens, tout en évidemment protégeant notre système de santé publique et universel.
And my follow-up question on a different topic, some maritime premiers have taken an interest in perhaps bringing in asylum seekers or hosting asylum seekers who are coming from the United States, particularly into Quebec. If so, would the federal government help them out financially with that?
Yes, absolutely. Over the past years, we've seen an increase in the number of irregular asylum seekers that cross into Canada at Roxham Road in Quebec. And the Quebec government and Quebecers themselves have been extraordinarily generous in welcoming and supporting the vast majority of irregular asylum seekers in this country. Quebec is seeing its capacities stretched to the limits, and it is great news that Atlantic provinces are looking at bringing in some of those asylum seekers while they go through the process of evaluation of their asylum claims. Just as the federal government has been there to support Quebec through the extra burden that it's put on their healthcare systems, on their housing, we will also be there to work and support the Atlantic provinces who want to help out with this challenge.
Thank you. Next question.
Hi, Prime Minister. Callum Smith from Global News. Your funding offer wasn't near what the provinces wanted. I'm wondering if this is a deal for a generation or if there's more money on the table to come in the years ahead.
We just put forward close to $200 billion on the table for the provinces to ensure that we are making concrete, tangible improvements in healthcare outcomes for Canadians. You know, Canadian families from coast to coast to coast keep hearing people throwing around billions of dollars here, hundreds of millions of dollars there, hundreds of billions of dollars there, and that's all money that doesn't mean anything near as much as, are you going to have access to a family care physician? Are you going to get that mental health support that you need when you're in crisis, when you need it? Are we going to see reductions in backlogs? Are we going to be able to get quality health data that shows how our system is performing? Are we going to be able to see our frontline heroes, doctors and nurses and personal support workers, properly supported as they're facing, stretched, thinned out, and burned out ranks? These are the challenges people want to be resolved, and that's what we're focused on. And quite frankly, the focus on data means that everything we do going forward will be tied to direct outcomes and results that Canadians can see. Making announcements about, billions of dollars more for healthcare doesn't actually tell you whether you're getting better results for healthcare. That's why what these negotiations are focused on is showing the actual concrete outcomes improving for Canadians.
Follow up.
Also on healthcare, Prime Minister, the family of a woman who died while waiting to access care in Nova Scotia has sued the Nova Scotia Health Authority. I'm wondering what you make of that and what more Ottawa will do to ensure more Canadians aren't dying while waiting to access emergency care.
The situation is heartbreaking. I think Canadians are rightly proud of having a universal healthcare system, but also very aware that that system is not living up to people's expectations. And tragic stories like this should not be happening. This is part of our motivation to not only make sure we're investing in long-term improvements in outcomes and results for our healthcare systems, but why we're also putting an immediate injection in the coming months of $2 billion into healthcare systems to help with backlogs, to help with pediatric care, to help with emergency rooms, to make sure that the provinces have all the resources necessary to prevent tragedies like this in the future.
Next question, please.
Good afternoon, Prime Minister. Mike Tutton from the Canadian Press. The Critical Election Incident Public Report, which evaluates potential instances of foreign interference during 2021, has not been released yet. And why has there been such a delay in releasing this report, and when will it be made available to the public?
In 2019, this government saw clearly what was happening around the world, the threats to democracies that we were seeing in the United States, in France, in other places where foreign interference from Russia, from China, from other actors around the world were attempting to disrupt and challenge the running of free and fair elections and the institutions that support democracies around the world. That's why we set up a critical incident election panel of our top public servants to independently have access to all the intelligence data to make sure that Canadians could have confidence that the integrity of our elections held. We set that up in 2019, and in both 2019 and 2021, the election integrity held. These panels did not have to weigh in or interfere or highlight that the integrity of our elections was compromised. That does not mean, nor have we ever contended, that there isn't ongoing efforts by countries like China to interfere in our democracies. That is something that we've been talking. We talked about it when we set up these panels back in 2019. We've talked about it regularly since. Our various agencies are tasked with supporting that panel and making sure that our integrity of elections holds. And Canadians can be confident that the results of both the 2019 and the 2020 election held. Now, the actual report, we have seen, we have heard from the panel that the election integrity held. The delay on putting out the actual report, you'd have to talk directly to the public servants involved, but we will be following up on that. Okay. Nous savions en 2019 que les démocraties dans le monde étaient de plus en plus assujetties à des attaques ou des attentats d'influencer les processus démocratiques, y compris les élections, dans les pays démocratiques à travers le monde, par des pays comme la Chine, la Russie et d'autres. Et donc, en 2019, nous avons créé un panel de hauts fonctionnaires indépendants, non partisans, qui avaient accès à tous les renseignements nécessaires de nos institutions de sécurité nationale pour pouvoir rassurer et confirmer pour les Canadiens que l'intégrité de nos élections ont été respectées. Et en 2019 et en 2021, c'est exactement ce qu'on peut confirmer. Mais on va continuer de prendre très au sérieux ces préoccupations-là, mais je pense que tous les Canadiens peuvent être rassurés que le travail de ces panels-là ont réussi à pouvoir confirmer aux Canadiens que nos élections sont intègres, mais que nous allons continuer notre travail. Et j'espère, comme vous, que le rapport officiel sera partagé bientôt sur les élections de 2021.
Next question, please.
Hi, Prime Minister. I'm Lindsay Jones with the Globe and Mail. You mentioned at the town hall that the spirit of the Health Care Act is to provide equivalent level of care across the country. And I also heard you say that the bilateral agreements are being negotiated based on targets provinces set for themselves. So what will happen if there is inconsistency across the country in terms of healthcare outcomes? How will the federal government, will you intervene to ensure consistency and equality?
I think it's fair to assume that if there are inconsistencies across the country in the coming years in outcomes, if some provinces have vastly better or vastly worse outcomes than others, given the transparency, the data sharing, the information that is integral to everything we move forward with on data, Journalists will be doing their jobs and asking that of the deliverers of healthcare, of the provincial governments that deliver healthcare. Unions will be asking their questions about how there are worse outcomes for their members who are working to serve partners. And Canadians, residents of those provinces, will be asking very legitimate questions as to why they are getting worse healthcare outcomes than their fellow Canadians who are living across a border or across a river or across the country. That's the beauty of transparency, because the way our country is set up, the federal government isn't the boss of the provinces. The provinces have full authority to deliver health care to their residents, and the federal government supports both by making sure that the Canada Health Act is respected and by delivering financial support so provinces can deliver that health care. But ultimately, the accountability is to citizens themselves, and the focus on transparency and data and the work that, whether it's the Canadian Institute for Health Information or others, do to ensure that everyone clearly sees what areas are doing better or worse than others, means that that public accountability will be as it must be. As people asking questions of those responsible for healthcare delivery, their premiers, their leadership, as to why we're not doing as well in this part of the country as we are in some other part of the country. That's the mechanism that we're moving forward with to ensure that Canadians get the best possible outcomes, and those who are responsible for delivering healthcare are held to account for that as delivery.
We have time for 2 more questions from local media.
Les provinces et les territoires livrent les systèmes de santé. Le gouvernement fédéral n'est pas le patron des provinces, n'est pas le boss. On est là pour assurer que la loi canadienne sur la santé est respectée, et on est là pour investir et pour soutenir une part de la livraison de services de santé. Mais si une province ou une région qui livre moins bien les services de soins de santé, à cause de l'emphase sur les données et la transparence et la redevabilité à travers le pays, les citoyens, les journalistes, les chercheurs, les syndicats vont être bien positionnés pour poser les questions pertinentes aux gouvernements provinciaux sur pourquoi est-ce qu'on n'est pas en train d'avoir la même qualité de service que d'autres reçoivent avec des fonds semblables. C'est comme ça que les Canadiens vont pouvoir être sûrs et certains des améliorations qu'on est en train d'amener à travers le pays dans la modernisation de nos soins de santé, tout en assurant une livraison de services dans notre système public et universel.
We have time for 2 more questions from local media.
Hello, Mr. Trudeau. My name is Anna Mandan. I'm a reporter with the Dalhousie Gazette. One of your election promises was $500 million to student mental health funds. I know last week the federal government promised $4 million to OCAD University. Will universities in Nova Scotia be seeing something similar?
We know that delivery of mental health supports, particularly to students, is extraordinarily important right across the country. Delivery of healthcare services is a provincial responsibility, but the federal government can and must step up to ensure that that is being delivered. That's where, in our health accords that we're negotiating now, the transparency and the accountability around outcomes for mental health supports is going to be so important, and there is a specific emphasis on young people and university students and mental health supports, because we know that if a person starts to get support for mental health challenges when they first manifest themselves in their lives, whether usually while they're young, they will be able to be better able to support and to challenge and to succeed through these challenges through the rest of their life. That's why we've always put an emphasis on being there for mental health supports for young people, including for students, and why we're so keen on working with the provinces to make sure that that gets delivered.
Last question, dernière question.
Good afternoon, Prime Minister. Evan Taylor, Acadia Broadcasting. One of the key components you've said as you're working towards these agreements is data, new data. But with that comes concerns over data security. And I'm wondering what role the federal government has to do as we implement new systems and the new provinces do that in protecting the data that we're now looking to utilize to improve healthcare systems.
That's a great question. The protection of Canadians' privacy is a primal, fundamental importance for the federal government. Canadians need to have confidence in the privacy of their personal data, of their personal information. That's why we have strong, robust cybersecurity experts across the country who work on protecting our data every single day. The CSIS is among the top agencies in the world. As we move forward on ensuring that the right data is available to healthcare professionals, we will do at the same time work to make sure that the privacy is protected. The role that the federal government has in that is actually sort of indirect. As we remember from the COVID vaccination app we had, the federal government didn't access people's medical health files across the country to make sure that they were vaccinated or not. That was something that stayed the information of the provinces, and the provinces just shared with the federal government the vaccination status of people who wanted to use that vaccination passport or vaccination app. These are things that we will always keep at the forefront because Canadians need to have confidence in their institutions, in their system, and the ability to protect people's privacy is fundamental, and it's absolutely something we will always ensure as a federal government.
Roxham, il y a l'ambassadeur Cohen qui laisse entendre que renégocier l'entente sur les tiers pays sûrs, ce n'est pas une priorité pour l'administration de Joe Biden. Je me demande donc quels sont vos leviers pour convaincre Washington de renégocier et si il refuse toujours, eh bien, est-ce que vous avez un plan B?
Je peux vous assurer que dans mes conversations directement avec le président Biden, il comprend à quel point c'est une priorité pour le Canada et c'est une priorité partagée de travailler ensemble pour assurer la sécurité de nos frontières, de notre frontière partagée. Et ça va certainement être une conversation que nous allons continuer d'avoir avec l'administration américaine, y compris lors de la visite plus tard le mois prochain. Merci beaucoup tout le monde. Bonne journée. Thank you guys.